Supporting mothers in their infant feeding journey, and everyone's journey is a bit different. This month is Breastfeeding Awareness Month, and help is out there for mothers looking for it. Laura Mason is here with us to share more from the health department. Thanks for being here today.
Thank you.
Yeah, I think, and I have said when I had my daughter, the first hardest thing besides, well, childbirth is breastfeeding.
Absolutely.
And I think that so many women think, hey, well, it's natural. It should be easy.
Right.
Yeah. And for some women, it is. But for others, it might take a little bit more work. So let's start off first, though, by talking about the benefits of making it work and breastfeeding and why it's good for babies.
Of course. So not only is it a great bonding experience for mom and baby, but when it comes to baby, it's good for reducing the risk of SIDS. It's good for thermoregulation and for pain management. Also for mom, it's really good for reducing those chronic diseases like diabetes and also obesity.
Right. So a lot of benefits out there, but it can be challenging for some moms. So you do have help available. Talk a little bit about how moms can get connected to services to help them through this process.
Of course. So we are directly through WIC. So we are right down the hall from them, and we have a service where we will help moms not only get their breastfeeding pumps through their insurance, but we have prenatal classes. We have hospital grade pumps that we also loan out to our WIC moms that their babies might be in the NICU. And then we also provide support for helping with latch, helping with just knowing how much baby gets.
Yeah, I think when my daughter was little, I was like, she doesn't need a lot because her belly is the size of a grape. But then in my brain was like, everything is fine when she really wasn't getting enough. So it does help to know how much they're actually getting. And I think sometimes with breastfeeding, you're like, I don't know how much they're getting.
Exactly.
So to be able to have those experts available to explain it a little bit. This is what a proper latch is like. This is things like that. So do you help quite a few moms? Do people take advantage of the resources?
Absolutely. I think we probably see 5 to 7 moms a day.
Okay.
So, and we've been even seeing a lot of non-WIC mothers too that have been referred to us, which has been really nice that we've been able to help more than just our WIC moms.
Yeah, and I think that moms, we want to do what's best for our babies.
Yes.
And sometimes there are some challenges with that.
Yeah.
So you have, during this month, have been doing a number of programs, right? What are some of the things that you all have done this month just to raise awareness?
So we are currently still doing our Storybook Walk, and it starts right at the front door. And it is the book, My Mom is Breastfeeding.
Okay.
And it's really nice. You follow the cues all the way, and you're not only are you reading the story, but when you get to our room, you get some goodies, like a book. There's some coloring book, and we have some stickers also. And then we also had an event a couple weeks ago at Seaway Marketplace, which is right down the street from us. And we had our breastfeeding peers there, and they were providing support and also some healthy snacks.
And how did that go? Did you see a pretty decent turnout, or are you hoping that more moms get connected?
Yes, I definitely hope that more moms get connected. I did see some comments even on our Facebook page that people missed it a little bit and they were hoping that they could catch something else. So I hope maybe in the future they'll get more connected by that way.
Yeah, and sometimes I think folks out there go, well, I didn't know these resources were there. I didn't know. What's the best way for moms to go about knowing where to find this information and to find these resources?
I have some plans for the future, of course, I would love to be more with social media. Of course, I would love to do more Instagram because I know our moms are on there, and then with Facebook and everything, and just providing what we offer in our events and everything that's coming up. Of course, there is the health department Facebook already, but I would love for ours also to be in there.
Yeah, so make sure that you just when you're scrolling,
Yes.
get connected to good resources, because we know when our babies are healthy and our moms are healthy, everybody's doing well. So how would you encourage people though? Maybe there are expectant moms. They're pregnant right now and they're like, I don't know what to expect or how to get prepared for this.
Right.
What would you recommend?
I would recommend even just calling us. We also have a text number, and we are very big with meeting mom wherever she wants to be. So we will of course say, if you want to breastfeed, we can help you. But if they want to bottle feed or just pump, we're also willing to help them do that too. So
'Cause we want them fed, right?
Yep, exactly.
And what is the exact agency you are with? Are you Lucas County Health
Yes,
Department?
I am
Okay.
Lucas County.
So if you live in Lucas County, and as you mentioned, WIC is right down the hall in the same building. So how
Yes.
important is that to have all of those resources, easy and right there together for people?
Yeah, it's so nice. We work together with WIC all the time. We have the dietitians just bringing moms down to us, and that way they are more informed of what we have to offer.
So don't be afraid to ask and
Yes.
to see what those resources, and as you mentioned, those free breast pumps.
Yes.
Take advantage of that
Yes.
through insurance and and get one of those, because
Exactly.
maybe if the latch isn't working, but the pump might, and then the baby's still getting that.
Yes, and it's really nice because we have insurance pumps right on site, so we can help mom get fitted and we can show them how to use it.
Very
So
good.
that way there's more supportive measures.
Get on Lucas County Health Department website, and find the section, get connected, and moms do what's right for you and your baby,
Yep.
and do the best that you can. It can be
Absolutely.
very challenging.
Yes, absolutely, very.
That support is there. Thanks for being here. We
Yeah,
appreciate
thank you.